Hello, I'm Sophia, an actor and sickle cell patient. In November 2021, the all-party Parliamentary group on sickle cell and thalassemia produced a report called No One's Listening. The report found serious failings in the care of sickle cell patients across the NHS, low awareness of the disease among healthcare professionals, and even overt racism. In response, we set out to listen to patients to understand their experiences of care in the NHS. We asked them to share what a sickle cell crisis feels like, how the pain can be properly treated, and what it's like to come to A&E. Most people with sickle cell come to A&E to have their pain treated when they've exhausted every possible option at home. It's important to trust your patients when they give you their pain histories, provide appropriate treatment, and check it works after you have administered pain relief.
Sometimes you'll tell them how much pain you're in and they won't really give you the pain medication you need. They'll be like, oh, just try and take a paracetamol, or they'll try and minimize your pain. Like you could say you're in a lot of pain and they'll be like, are you really in that much pain? Or you could be like, oh, I might need this medicine that you know that works for you. And they'll be like, do you really need this medicine? So sometimes it can be a bit reluctant, which I understand why, to give you heavy medicine, but you can't really tell someone how much pain they're feeling until you're in that kind of pain. And sometimes if you're screaming out of pain or like thinking, they'll be like, oh, just relax or just calm down, which I understand they think is trying to help, but it could just make it worse because screaming is kind of like how I let go of my pain, and being quiet, and if I just keep it in, it just makes the pain worse.
A lot of children, if they're not expressing pain, are not believed to be in pain. So especially like in the Black culture, I feel we're more taught to suck it up, or don't make too much of a fuss. So it might be deemed that this person is not in pain, but they could be holding in a lot of pain.
Because people expect you to be wincing, to be rolling around, and if you've been dealing with a condition all your life, and you're 35 years old, or 20 years old for that matter, you've found ways of managing, and so you don't always show those obvious signs. And what we also want is for when a patient says, my pain is 10 out of 10, for people not to say, well, you don't look like you're in pain, and you're watching TV and you're laughing with your friends on the phone, so you can't be in pain. We've taught our son to distract himself. Don't focus on your pain, because focusing on it isn't going to make it better. So if someone isn't looking like they are in pain, it doesn't mean that they're not in pain, and pain is what the person says it is.
If you are in an environment where they know you and you just tell them, I tell them all the time, call the sickle cell team. And immediately everything starts to move.
Sometimes it can be cold and you'll ask them to turn the heaters up and they'll be like, oh, we have other patients. And sometimes if there was a period of time where it was really crowded, so like you couldn't have a bed, they would make you sit on a chair and things. But the nurses can be really helpful. They'll come and they'll offer like, do you need a hot, not water bottle, but like this bag of fluids heated up, do you need water? Or they'll ask my mum, do you want some tea, do you want a sandwich? So yeah.
And sometimes they try to move where it hurts, and then I've just think it's like really gotten worse. So when I'm in A&E, I feel like they should just ask how the pain is and not like feel it, because it might hurt the person that's in the sickle cell crisis. Like in the x-ray, it did really hurt when they were like trying to bend my arm and trying to straighten it out, because when I'm in crisis, I tend to like really bend it a lot because it really hurts. So when they're trying to straighten it out, it does really hurt. And then when I went back up to short stay, I was in a lot of pain. but before I did the x-ray, I wasn't in a lot of pain.
They just forget that actually our patients can look brilliant on the outside, but they can unravel quite quickly, and patients often can feel that happening. But you looking from the outside, patients compensate, all their observations look pretty good until they don't look good, and then you've often missed your opportunity to intervene and change the course of events.
You definitely have people where, think you are making it up, or again, there's the other thing where they think that the pain isn't as bad as you're making it. And I don't know which is worse, that, you're thought of as a drug addict, or that, okay, you are in pain, but it cannot be possibly as bad as, why are you screaming, bring it down, and all of that. And it can be quite trying.
When a sickle cell patient presents at A&E, they should be given pain relief within 30 minutes, after which they need to be monitored frequently. Please be aware that adult patients should have their own individualized care plans, while for most pediatric patients, follow the generic pain protocol. Sickle cell disease is complex and patients need specialist care. So as a priority, please inform the sickle cell team as soon as possible when one of their patients presents at A&E. Patients' progress in A&E should be monitored frequently for any adverse effects to their medication and to make sure the pain relief is effective. With many medications, patients will also need to be given some food. People undergoing a sickle crisis must be kept hydrated. Though it's possible, extreme pain will make drinking difficult, and you may have to start intravenous fluids. If they can't get to the bathroom, they may also need help with a commode. Sickle cell pain is also exacerbated by the cold, so it's important that patients are given blankets and not asked to wait in particularly cold areas, such as near air conditioning units. Please be empathetic to patients' pain and beware of how unconscious bias may lead to patients being inadvertently treated differently as a result of a particular characteristic, such as their ethnicity. Someone with very severe pain may still be able to read a book, use their phone, have a conversation, or sit still. Even young children are capable of creating distraction techniques that may seem odd to someone who has never experienced sickle pain. Thank you for watching this video today. Next time you look after a sickle cell patient in A&E, I hope the interaction is enriching to you and beneficial to them.